Have you experienced some medical conditions and you're wondering whether you should be going to the emergency department or to the urgent care? And time is not on your side, and you want to save money, and so you don't know whether urgent care or ER is appropriate. On today's video, I'm going to show you 10 reasons why you should go to the urgent care and not the ER. The first reason is upper respiratory infection. Now, this could be a cold, the flu, strep throat, or even COVID infection. You don't know whether you've been exposed, or if you know you are exposed to any of these infections, then you're wondering, should we go to the ER or you should go to the urgent care? If your symptoms are not severe, they are mild symptoms, and you've been exposed, then the urgent care is the place to go because they have the capability to make this diagnosis and treat you appropriately. If you have severe infection, chest pain, shortness of breath, you're drooling, you can't swallow, then going to the urgent care will be a waste of time. You should go to the ER because you're going to need additional testing to make the diagnosis and treatment. The second reason why you should go to the urgent care and not the ER is minor injuries like sprains and strains. If you have a minor injury, a strain of your ankle, and it's not so severe and you don't know what to do, sometimes people even will try applying ice, elevating their foot, taking some ibuprofen, or the patient is limping. They don't know what to do. They've tried these things and they're working. Then urgent care is a place to go because they'll be able to differentiate whether you need an X-ray or you don't need an X-ray. The third thing that will let people go to the ER will be cuts and lacerations. So if you have a cut and it's not bleeding actively, it's not oozing blood, the blood is not gushing out, and you're able to put pressure on it to stop the bleeding, but the cut is deep that you think that you might require a suture, then urgent care can take care of that for you. And even if you need a tetanus injection, they can actually provide that for you as well. So minor cuts and lacerations, and maybe worry about infection, those ones, urgent care can take care of you. But if you're having a cut that you are gushing up blood, you can stop the bleeding yourself. It's bleeding so badly, then you may have lacerated a vessel, an artery, or a vein, and you are going to require to see a specialist to take care of this for you. And so, ER will be the place to go. The next one, number 4, is UTI. Simple, uncomplicated UTI, especially in the female, urgent care is a place to go. If you're male, yes, you can go to urgent care as well, and they'll be able to get some blood urine culture for you and treat you. Some of these things you cannot do them on virtual care, so you have to go in person. But if you have like fever, vomiting, retching, back pain, you may be developing what we call pyelonephritis or a more serious infection of the kidney, so you should go to the ER. But just uncomplicated UTI, yes, urgent care can take care of this for you. The next one is ear infection and ear pains. Now, if you have any form of ear pain and ear infection, whether it's swimmer's ear or your middle ear infection, you probably want someone to take a look into your ear for you to differentiate between the two, because sometimes people do virtual care and they end up paying twice because in virtual care, doctors cannot take a look inside of your ears. And so you end up they may treat you wrongly, not because the doctor is bad, but because they couldn't look in your ear to differentiate between the external ear infection and middle ear infection. So any ear pain, I recommend you go in and be checked in person, especially for children. Never do a virtual care for children with ear pain. You end up paying twice because the doctor will refer you to go to see a physician to look inside the ear of your child. The next one is various skinning problems like a rash, a back bite, allergy reaction to your skin, poison oak, poison ivy. These are things that most of the time we cannot treat on virtual care. So urgent care will be the place to go where somebody can examine your skin and make the diagnosis and treat you. The next one, number 7, fever or flu-like symptoms. You have an ache, fatigue, just not sure, you're exhausted, you're burnt out, you don't know what is going on. You have a fever. If it's a low-grade fever, I think you can take just a Tylenol, ibuprofen over the counter and treat yourself. However, fever of 103 degrees, that tells you something is going on, especially if you have fever 103 degrees, 103 degrees 3 days in a row, an adult, you should go in and be seen in person. If you're a child less than 3 months old and you have a fever of 100.4 degrees Fahrenheit, that is considered life-threatening for the child. In fact, that child should not even go to an urgent care, but go to the ER, because you're going to need what we call a fever workup for the child. So that's very important, all right? Fevers and, all this minor illness. Next one is all stomach issues, nausea, vomiting, diarrhea, food poisoning, stomach bag. If you have these conditions, most of the time they're able to go away within 72 hours, by just treating yourself symptomatically and drinking a lot of fluids, resting your bowel, not eating, just taking it easy. Yes, but if after about 20, 48 hours it's not going away, 72 hours, or you have a fever with it, you have abdominal pain, you're having pooping blood, in your stool, yes, you should go into the urgent care and be seen immediately, because you need somebody to examine you to make sure you don't have a serious condition going on. Number nine is back pain. Any strain of your back, you're lifting up something, you pull the back muscle and you're sore, you've tried, painkillers, working, then it's a good idea to go to the urgent care. However, if you're having like severe numbness around your thigh area, around your pelvic area, very severe numbness, the pain radiating to your back, you have leg weakness, you have bowel or bladder incontinence, that is a life-threatening emergency, and you should go to the ER, because it's going to require to do certain imaging like MRI. So urgent care will not help you. The last but not the least is pink eye of any form. There are several kinds of pink eye. So if you have any form of pink eye, yes, you need somebody to go and take a look at it. It could be allergic, it could be viral, it could be bacteria. So make sure somebody take a look at it for you. Some virtual cares can take care of this for you sometimes, but most of the time, if you have pain in your eye, move your eyeball, it's very painful, or you have swelling of the eyelids, the eyeball is swollen, if you move your eyeball, it's very, very painful, it's red, that will be more life-threatening. So urgent care may not be able to help you. You need to go to the ER for that. So these are the 10 conditions that will require that you go to urgent care instead of the ER. And so I want you to give me a like here. If this has been helpful for you, I'll save you a lot of money, so that you don't want to waste time going to the ER and wasting money. So if this has been helpful, give me a like, subscribe to our channel, share this video with other friends, and come back here weekly for tips for your health. Until then, this is Dr. Moses. I'll see you on the next episode.